Doing a room scan. Knock knock, my name is Q1. I'm gonna be your student nurse today. I'm gonna wash my hands and then I'm gonna provide the patient privacy. Can you verify your name and date of birth for me, please?
Julia Shepherd, January 13, 2003.
All right, that's correct. So we've already obtained your vitals, so I'm gonna go ahead and do a physical head-to-toe assessment on you. So how is your sleep and your eating been?
I've been okay. Sleep has been okay. Eating has been okay.
All right, and what's been your main concern? What brought you to the hospital today?
My stomach pain.
All right, patient has complained of stomach pain, so we'll come back to that. And the patient has already verified their name and date of birth and their situation. So I would just ask, can you tell me what place you're at?
I'm at NSU.
And could you tell me approximately what time it is?
It's about 5 o'clock.
Alrighty, and let's go ahead and see about that pain. When did it first start?
Last week.
Well, hold on, give me 1 second. I'm gonna go back. The patient is AAO times 4.
Okay.
So about that pain, when did it first start?
Last week.
Alright, and can you point to where it is, Willie?
All right here. Close to my pelvic.
And about, does it come and go, or is it like a consistent pain?
It's comes and goes.
And how would you describe this pain? Is it dull, sharp, stabbing?
It's sharp, but maybe that's
Okay. Are there any aggravating factors? Anything that makes it worse?
I'm not using the restroom.
Let's see. And does it radiate? Does it move anywhere, or is it just in that one spot?
It radiates from side to side sometimes.
All right. And what about have you been taking anything to treat it, or?
Ibuprofen and Tylenol.
All right. And for that severity, what would you rate it on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain?
Probably like an 8.
All right. So we're gonna come back to that pain, and we're gonna first assess your pupils. So, can you tell me how many fingers I'm holding up?
3.
All right. Cranial nerve 2 is intact, and with 3, 4, and 6, I will test those by doing the 6 cardinal gazes. So just look at the tip of the pen and follow it. Do not move your head. Alright, cranial nerves 3, 4, and 6 are intact. Let's see, with 5, I'm gonna say I for me. Mucous membranes are pink and moist. Don't see any lesions, good dentation. You can go ahead and do 7 as well. Clench your teeth for me. Blow your cheeks out and raise your eyebrows. So 5 and 7 are intact. With number 10, I believe, are you having any difficulty swallowing? Let's see. And then with 8, I'm gonna test your hearing with cranial nerve 8. So I'm gonna whisper something in your ear, and I just want you to repeat it back to me.
Okay.
So
1, 2, 3. 1, 2, 3.
All right. Cranial nerve 8 is intact. With 12, you can just stick your tongue out for me again. Move it side to side. No lateral deviation. My hands may be cold, but against resistance, can you turn your head towards me and against your shoulders? I believe cranial nerve 11 is intact. Let's see. So now I'm gonna do your lungs, I believe. And also your eyes were pearly. The pupils were equal, round, reactive against light and accommodation. So let's go ahead and do those lungs. Upon inspection, the chest falls symmetrically. breathing is even and unlabored. I'm gonna go ahead and do auscultate your lungs. Let's see. Here. Could you displace your breast for me, please? Lungs are clear to auscultate. Could you sit up for me, please? And could you give yourself a big hug and tuck the chin in, please? Let's see. Take a deep breath in, please. Alright, and I'm gonna do your lateral sides. So just the 3 over here. Deep breath in, please. Alright, you can lay that down for me. Lungs are clear to auscultate and bilateral. Next, I'm gonna do cardio, which is your heart. We'll start on the aortic valve, which is on the right second intercostal space. Then I'll go to the pulmonic valve, which is the left second intercostal space. And then the Erb's point, which is the third intercostal space. And then, could you displace your wrist in there? The fourth intercostal space, which would be the tricuspid valve. And then the mitral valve, which would be the fifth intercostal space, mid-clavicular line. Let's see. 1 second. After that, I believe we start your abdomen assessment. Let's see. So upon inspection, no lesions, no scarring. Skin looks normal to ethnicity, the color. Okay, hold on. With the heart, the S1 and S2 were distinctly heard and the rhythm was regular. Back to the abdomen. Upon inspection, looks normal. Looks about round or flat. Color looks normal to race. Looks clear to auscultate. So I'm gonna go ahead and start that. But before I auscultate, could you do a crunch so I can see if you have any hernias? No hernias noted. And then I'll auscultate, and let's see. I'll start in the right lower quadrant, and move up to the right upper quadrant, and then the left upper quadrant, and then the lower left quadrant. Let's see, and then I will rehearse, I believe. So let's start right here, go to the right upper quadrant, left upper quadrant, left lower quadrant. Then I'll palpate. Let me know if I feel any tenderness or anything like that. Starting in that right lower quadrant, the right upper, left upper and then left lower. And let's see. Also, could you sit up for me so I can check your backside? And, no lesions on the scalp or the scapular or the coccyx or the bottom of the heels. So I'm gonna move on to your periphery. So you can lay down again. I'm gonna check your bilateral upper extremities. I'm gonna use the back of my hand to check for temperature. Skin is warm to the touch. I'm checking for edemas. No pitting noted. Check for capillary refills on all fingers. Instant capillary refills less than 3 to 5 seconds. And I'm also check skin turgor on both hands. Instant skin recoil. I'm also go to your lower bilateral extremities. Again, using the back of my hands to check for temperature, and then pressing inward to check for edema. No pitting noted. Skin is also warm to the touch and moist. The color is still correct for the ethnicity. I'm gonna check the capillary refills on the toes. Alright, instant capillary refill, less than 3 to 5 seconds. And I'm also check for the dorsalis pedis post. And it is equal bilaterally, plus strength and regular rhythm on both sides. Also, I'm gonna check your, I think I forgot something. I'm gonna check your dorsiflexion and your plantar flexion. So could you push down against my feet like a gas pedal? And could you pull up against me? All right. Both of those are intact. I think I forgot your neuromuscular. Could you grab my fingers and pull for me? All right. Strength is equal in both hands and both feet. What am I forgetting? Pulses. Your radial pulses. Let's see. Radial pulse is equal bilaterally plus your strength, and rhythm is regular. I think that concludes our head to toe assessment. So I'm gonna go ahead and get your safety. I'm gonna pull up lower the bed to the lowest position. Pull up both bed rails. Make sure there are no IV lines or and the dressings are still intact. And I'm gonna ask, do you have to go to the bathroom? Mm-hmm. Are you still in any pain?
Not right now.
Do you need to be moved?
No, I'm good.
And is everything in reach?
Mm-hmm.
Well, if that's okay, I'm gonna go ahead and end this assessment and make sure I get all of this to your primary care provider.
Thank you.
All right, thank you.